This is the second video on the irritable bowel syndrome, and we'll discuss the causes and diagnosis. What causes IBS? There are many explanations, but the exact cause is not known. IBS is believed to be due to an intestine that is very sensitive to pain. The same amount of gas distension of the large intestine in an IBS patient causes pain, while a healthy person doesn't feel anything. Secondly, there's also problems with muscle contractions of the intestine. The muscle contractions of the intestine may be too fast or too slow. When it is too fast, the transit time for passage of stools through the intestine is quick, resulting in watery stools. If the transit time is too slow, the bowel has more time to absorb the water from the stools, and the stools become hard and more difficult to pass. This results in constipation. Some people develop IBS after severe food poisoning. It is not uncommon to get IBS after severe food poisoning. The food poisoning or acute gastroenteritis could be due to bacteria, virus, or parasite. It is believed that about 10% of patients develop IBS after food poisoning, and the risk of IBS is increased sixfold if someone suffers from food poisoning. The type of IBS that usually follows is the diarrhea predominant type. Age is an important factor in the sense that younger patients who get food poisoning are more likely to develop IBS. Another possible cause is an abnormality in the gut-brain axis. Let's look at the gut-brain axis. The gut-brain axis is a bidirectional system of communication where the brain communicates with the gut. The gut means the stomach and intestines, and the gut also communicates with the brain. This communication is done via nerves, hormones, and gut bacteria or microbiota. Normally, the brain and gut work together to control digestion, and this is done via nerves and hormones and signals released by the good bacteria in the gut. Stress can affect the brain and results in poor coordination between the brain and gut. This is believed to cause the intestine to act abnormally. The abnormality is an intestine that is hypersensitive to pain. The other abnormality is a change in the muscle contractions in the large intestine. Too fast and one gets diarrhea, and if too slow, constipation. Experts are not sure whether stress causes IBS or IBS results in stress and anxiety. But we know that stress and anxiety may trigger IBS, and this most likely works via the gut-brain axis. It appears that the composition of the bacteria in the intestine is important as it affects the signals that are sent to the brain via the gut-brain axis. It has been noted that the gut bacteria or microbiota in the intestines are different in IBS patients compared to healthy people. Genetics may play a role as some patients have family members who have IBS. So these are some of the reasons why patients develop IBS. Now look at diagnosis of IBS. There are certain criteria that have to be fulfilled before the diagnosis of IBS is made. There are some people who may seem to have symptoms of IBS, but in fact might have another more serious condition. So it is best to consult a doctor. The doctor will take a history, conduct a physical examination, and whenever necessary, order investigations to determine the diagnosis. The doctor will then proceed to make a diagnosis based on 3 criteria: whether symptoms the patient tells a doctor fits into the criteria for IBS, as I've discussed in the first video. The doctor will take a history and do a full medical examination before he determines whether the symptoms fulfill the criteria. That there are no alarm symptoms or risk factors for a more serious medical problem other than IBS. These alarm symptoms are weight loss, age of onset above 50, blood in the stools, anemia or lack of blood, fever, family history of colon cancer, celiac disease, or inflammatory bowel disease. The doctor might proceed to do further tests if the doctor suspects that there could be another medical problem that might present with symptoms similar to IBS. These conditions include celiac disease or gluten sensitivity, inflammatory bowel disease or chronic inflammation of the colon, colon cancer, especially in older patients, microscopic colitis, which is inflammation of the colon that is only seen under a microscope, and bile acid malabsorption. These conditions will be discussed in greater detail in the video on chronic diarrhea. The doctor might proceed to investigations to rule out other conditions that have similar symptoms to IBS. Remember that in IBS, all investigations are expected to be normal. The tests that might be ordered include blood tests that could include blood counts and thyroid tests, stools tests to look for bacteria and parasites, blood test for gluten sensitivity or celiac disease if in high-risk group. Colonoscopy might be ordered for older patients or in those with alarm symptoms. Colonoscopy is a procedure where a thin flexible tube is passed from the anus and examines the whole length of the colon. If indicated, imaging tests like ultrasound abdomen, CT abdomen, small bowel X-ray or imaging might be done.